COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose, or mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19.
The virus that causes coronavirus disease is spreading in some of our communities. This disease, also known as COVID-19, is thought to spread mainly from person to person through respiratory droplets produced when an infected person coughs or sneezes. These droplets can spread to the mouth, nose, or hands of people who are nearby or possibly be inhaled into the lungs. Take steps to lower your risk of getting sick. Here are some things you should do. Wash your hands often with soap and water for at least 20 seconds. You can also use hand sanitizer that contains at least 60% alcohol. Take extra measures to put distance between yourself and others. Avoid close contact with people who are sick. Stay home if you're sick, except to get medical care. If you have severe symptoms, please call 911. Cover coughs and sneezes with a tissue or the inside of your elbow. Only wear a face mask if you're sick and around other people, or if you need to take care of someone who is sick. Clean and disinfect frequently touched surfaces. Older adults and people who have severe chronic medical conditions like heart or lung disease or diabetes are at higher risk for more serious illness from COVID-19. This group should consult with their healthcare provider about additional steps to stay protected. For more information on COVID-19, please visit cdc.gov/COVID-19. Let's work together to protect ourselves, our families, and our communities.
CDC has resources posted at cdc.gov/COVID-19 to help you determine if medical care is needed. A guide to help you make decisions and seek appropriate medical care, and a coronavirus self-checker. If you develop emergency warning signs for COVID-19, get medical attention immediately. Emergency warning signs include difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or inability to wake, bluish lips or face. This list is not all-inclusive. Please consult your medical provider for any other symptoms that are severe or concerning. Learn more at cdc.gov/COVID-19 and coronavirus.gov.
Medical masks should be worn by health workers and those caring for someone with COVID-19 symptoms, persons aged 60 and over, and anyone with pre-existing medical conditions, as they are at greater risk of developing serious illness, and people who have symptoms suggestive of COVID-19. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. Inspect the mask for tears or holes. Do not use a mask that has previously been worn or is damaged. Verify which side is the top. This is usually where the metal strip is. Identify the inside of the mask, which is usually the white side. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Pinch the metal strip so that it molds to the shape of your nose. Remember, do not touch the front of the mask while using it to avoid contamination. If you accidentally touch it, clean your hands. Now, how do you take off a medical mask? Before touching the mask, once again, ensure that you clean your hands with alcohol-based hand rub or soap and water. Remove the straps from behind the head or ears without touching the front of the mask. As you remove the mask, lean forward and pull the mask away from your face. Medical masks are for single use only. Discard the mask immediately, preferably into a closed bin. Clean your hands after touching the mask. Always be aware of the condition of the mask. Replace it if it gets soiled or damp. A mask alone cannot protect you from COVID-19. It must be combined with other measures, including maintaining at least 1 meter distance from each other, washing your hands frequently, and avoid touching your eyes, mouth, and nose while wearing a mask. Stay safe and help prevent the spread of COVID-19.
To prevent the spread of COVID-19, here's a few points to note for returning to the workplace. Adopt flexible working hours. Wear a mask when taking public transport. Check body temperature when entering office buildings. Avoid crowded lifts as far as possible. Avoid holding or joining large-scale meetings. Reduce face-to-face contacts with coworkers. Arrange flexible meal hours. Avoid meal gatherings. Wash hands frequently and maintain good environmental hygiene at the workplace. After work, avoid crowded places. If you feel unwell, don't go to work and seek prompt medical advice. For more details on preventive measures in the workplace, visit coronavirus.gov.hk.
We can balance public health and economic stability. Returning to work as safely as possible is like driving. There's a shared responsibility for safety and multiple layers of safeguards to protect us. On the roads, we have lane lines, guardrails, stop signs. We'll need a new infrastructure like that at work. Barriers between desks, shields separating employees and customers, workflow redesign in factories. We also have rules of the road, like speed limits. We'll need new policies and procedures, like temperature checks, alternating work schedules, and frequent deep cleaning. And then there's your own behavior, like using your blinker or wearing your seatbelt. We'll need everyone's commitment to frequent hand washing, wearing masks, and staying at home if you have symptoms. The new normal won't be the same for every workplace. Driving on an 8-lane highway is different than cruising down a neighborhood street. But every workplace will need a new normal. Getting back to work without it is like everyone driving with a blindfold.
Hello, my name is Eric Chang. I'm the program lead for employee safety. We'll be going over 6 best practices for disinfection and cleaning in the office and non-clinical areas. Before we get into the 6 best practices, it is important that you choose the right product for cleaning. One thing to look for is the DIN number or the drug identification number. This is a sign that Health Canada has reviewed the product and it's going to work. If you're not able to find a surface disinfectant, you can make your own. It's 1 part bleach and 10 parts water. Keyboards in the office are notorious for being dirty. It's important that you pay attention to the palm rests, space bars, and the cracks and crevices. Common surfaces like kitchenettes, conference tables, and countertops need to be cleaned more often to stop the spread of germs. Mobile phones follow you everywhere. It's important that you avoid placing your phone on communal surfaces and clean them frequently, like before you come into the office and before you go home. Think about cleaning behind the case cover as well. Office supplies like staplers, photocopiers, and pens are true criminals for spreading germs. It's important you take time to clean or wipe down your supplies to stop the spread of germs. High contact surfaces like doorknobs, elevator buttons, and faucets are known to have a lot of germs. Wash your hands after touching these surfaces. Personal items like purses and backpacks should be kept off of the floor and communal surfaces. This helps stop the spread of germs.